Atlas Kuzangpola. This is my first scientific paper presentation, and what could have been more auspicious than to get an opportunity to present my paper in the first ever National Sorig Conference. So today I'll be presenting on the perspectives on chronic musculoskeletal pain management among healthcare professionals in Bhutan. It is a qualitative study. So the overview of my presentation will be introduction, methods, result, discussion, and conclusion part. To begin with the introduction, MSK, or the musculoskeletal pain, is a leading health problem that leads to the people to visit hospitals. And though the burden of musculoskeletal pain is equal in developed and developing countries, but the burden on the developing countries are disproportionately high due to the ill-equipped healthcare system, overburdened with the infectious diseases, emerging non-communicable diseases, and other health emergencies. Musculoskeletal pain is complex and multifactorial. In most of the non-traumatic musculoskeletal pain, it is not possible to point out the exact pathoanatomical structure to adequately explain the pain intensity and the disability that the person is suffering from. Therefore, for instance, a low back pain, chronic low back pain, is a complex interaction of psychological, social, neurophysiological, cognitive, and behavioral factors. However, traditional methods of treatment consist of identifying the abnormal structure and to treat that abnormal structure. However, despite the advancement in the medical science and the advancement in the radiological imaging technologies, we continue to see the increasing burden of the musculoskeletal pain disorders. That is when the researchers and experts around the world said that we need to shift the paradigm from the biomedical oriented treatment to the more holistic, for now, which they call it as biopsychosocial approach to chronic musculoskeletal pain management. However, as the healthcare professionals are trained in the biomedically oriented approach, the healthcare professionals across the world express that they have inadequate skills and there is a lack of clinical guidelines, especially in the developing or the low and middle income countries. If we look at the national picture, the musculoskeletal pain disorders in 2003 was the 9th most common morbidities that lead to the people to visit hospitals, which jumped up to 4th position in 2019. And in 2023, the musculoskeletal disorders continue to be the 4th leading cause of people to visit hospitals. To discuss about the methods of our study, we implemented generic qualitative inquiry methods with the interpretivist paradigm, so that that method allowed us the flexibility to record the beliefs, opinions, and the experience of the participants. And we used consolidated criteria for reporting qualitative research to report our findings. To give a brief summary of the participants, we recruited participants with a clinical experience of 6 months to 35 years in the experience in treating chronic musculoskeletal pain. We also tried to recruit the traditional physicians and mentors for this study, but we found out that the worldview and the approach to the chronic musculoskeletal pain is way different. That's why we thought that it deserved a separate study for the traditional physicians. And I invite all the interested individuals to explore that one in your studies. So if you look at the participants, we can see participants from all levels of 3 tiers healthcare system, that is primary healthcare, secondary and tertiary. However, you can also see that most of the participants are concentrated in the tertiary healthcare system because most of the healthcare professionals who are dealing with the chronic musculoskeletal pains are concentrated in tertiary healthcare system. Data collection, we employ, it was during the time of pandemic, that's why we employed the Zoom to collect the data. And we employed semi-structured questionnaire to collect the data. Semi-structured questionnaires were developed through the intensive literature review, brainstorming among the co-authors, and also we sought the expert views of the international experts who are dealing with the chronic musculoskeletal pain. Then to maintain the quality and reliability of our study, we have employed 6 steps thematic analysis that was being prescribed by the Brown and Clark. Results, first one was the perceived health-seeking behaviors among the patient. So most of the healthcare professionals, they reported that they first try the home remedies, and if they are educated people, they browse the internet, go to the Google, go to the YouTube, and try all the exercises or remedies prescribed in internet. And if it doesn't get better, then they first seek the help of the local healers who are located in the different pockets of our community. Then only they come to the hospital seeking both the allopathic and traditional medicines healthcare services. Then second overarching theme was that the approach that has been employed by the Bhutanese healthcare professionals were biomedical approaches in chronic musculoskeletal pain management. And you will also be able to view some of the verbatim quotes from the participants. And they also acknowledged the fact that though they know that psychological and social factors are involved in chronic musculoskeletal pain, but they feel that they do not have the adequate skills to explore that on. And some even said that it is not the scope of their practice to explore the psychological aspect of the chronic pain. And then they also said that the most important thing in the chronic musculoskeletal pain management is to rule out the red flags, including cauda-equina syndrome, infections, tumors, and other pertinent red flags. Then the third overarching theme was barriers to chronic musculoskeletal pain. That what is first one is they acknowledge that chronic musculoskeletal pain is very complex and difficult to treat. Some even said that no matter what they try, the patient keeps coming back saying that it did not get better. Then another one is time constraint. As the healthcare professionals have to deal with lots of patients, they acknowledge that they do not get adequate time to listen to all the psychological and social aspect of the chronic pain management. Then there is lack of confidence, knowledge, and skills in dealing with chronic musculoskeletal pain because they said that they do not get adequate preparation in the universities or colleges to deal with the chronic musculoskeletal pain because most of the time it is assumed as a non-fatal and irreversible disease condition which do not require much of our attention in the college and universities. Then another one is inadequate facilities and expertise to treat or provide the services to the patients with chronic musculoskeletal pain. Then they also suggested the strategies or way forward to provide holistic chronic musculoskeletal pain management in Bhutan. That is training in the biopsychosocial model of care or holistic model of care for chronic musculoskeletal pain patients. Then they also suggested that the chronic musculoskeletal pain management should be included in a university curriculum. Then third one is need of clinical practice guidelines so that all the healthcare professionals and clinicians dealing with the chronic musculoskeletal pain will be able to provide the similar level of care to the patients with chronic musculoskeletal pain. Number 4, educating general public about chronic musculoskeletal pain as part of the public advocacy so that they seek the right or the most appropriate healthcare services. Discussion part. So health-seeking behaviors, it is very reflective of our socio-cultural beliefs that first they seek the help of the local healers, or if they are educated people, they tend to browse internet, look at the YouTubes, and this by themselves before coming to the hospitals. So local healers, they also try Bhutanese traditional medicine, home remedies. Some they try for the try to seek the solution from the internet. And I think the Bhutanese traditional medicine is a very holistic alternative medicine to treat the chronic musculoskeletal pain, provided that it is based on the philosophy of Buddhism, and also it reflects the socio-cultural beliefs of our population. So I feel that the traditional medicine can play a very big role in treating the chronic musculoskeletal pain. And sometimes I also feel that allopathic medicine may be seeking help, or maybe seeking the alternative in traditional Bhutanese medicine to give them the holistic care that is both traditional medicine as well as the allopathic medicine. Then biomedical model of care. So uh, all the healthcare professionals acknowledge that the psychosocial factors play a very important role in chronic pain management, but they said that their treatments are predominantly biomedical oriented care, as it was found in any other low and middle income countries. Then they said that red flags screening is very important, which is in line with the best practice from the world. Then they Then some of them also acknowledge that psychosocial factors are out of scope for them, or it is too sensitive to explore the psychological domains of the patient. And then barriers and strategies. Chronic pain management is inadequate in Bhutan. We are aware of the biopsychosocial model of care, but inadequate skills and knowledge, which is due to the lack of training and education. Then maybe the appropriate trainings such as cognitive functional therapy, which is a psychologically informed physiotherapy approach that would be very helpful for our healthcare professionals to provide holistic care. Then there is also lack of the clinical guidelines, especially in terms of the chronic musculoskeletal pain, which we can implement. Then the strengths and limitations of this study. This is the first ever study exploring barriers and strategies of managing chronic musculoskeletal pain. And all the authors out here are Bhutanese, which is very helpful to contextualize our study to our setting. Then the samples are very representative because we included them from all three levels of the healthcare systems. Then maybe a follow-up qualitative study is required to validate our findings in this study, because we only employed 19 participants, though we achieved saturation by 17 participants. And we considered it saturation when there was no standout new ideas or concepts coming out of the interviews. Conclusion. So we still, Bhutanese healthcare professionals still provide biomedically oriented care to the patients, though they are aware that they need more holistic and integrative biopsychosocial approach of care. So psychosocial dimension is considered important, but they require comprehensive training to adequately train all the healthcare professionals to provide that holistic care. So with this, thank you and Karinjan.